Aparna, Jonnal. I remember some faces from last time. So I am one of the doctors at Person Memorial Hospital. I work in the ER there, and I'm also the director right now. Ever since I started working there, I started in 2016, I think, or 2016. I noticed that we really need to increase, I think, our connection with the community and let you all know that we're here, what services we provide, that we would love to take care of you, and when you should come and see us, okay? I wanted to say, first and foremost, the main message of this talk is if you feel like you need to go to the ER, it's okay, go, okay? We are always happy to see you. Even if you come there and it turns out it was a problem that you could have gotten taken care of with your regular doctor or urgent care, it's okay, we are not there to judge you. If you perceive it as an emergency, come, okay? We see everything. I saw someone with a hangnail. Do you see what I mean? And I was not mad at them. That is just what they needed right then, is some help with their hangnail. So you come to us whenever you perceive an emergency. Also in your age group, especially with seniors, I would like you to encourage you even more to come to us, because as we age, the problems that we face do get a little bit more serious. And so a stomach pain in an 18-year-old, you could probably wait a day or two. If you're 60 and over, a serious stomach pain can sometimes be something life-threatening. So we want to see our seniors even quicker. So I sometimes see people say, oh, I tried to battle this out at home. Don't worry about it. If you are feeling sick, you can come and see us, okay? The only reason I'm going to divide things up into like ER versus urgent care versus primary care is to save you an inconvenience. If there's something that you could go to an urgent care or your primary, then we don't want you to have to wait in the waiting room and deal with all the hassles of the ER, of course, too. So there are some things for which you should see your regular doctor. So I thought what might be interesting is if we were to just kind of divide this into the ER and then urgent care and then primary care. And of course, there's some things that you could just wait on, like a hangnail. You don't have to go anywhere for that necessarily. Right. But so I thought maybe you could bring up like a diagnosis or a symptom or a problem you've had recently, and then we could see like which category that might go into. Just...
Oh, I got one.
Yeah, tell me about it.
Well, in the month of October, I went and I had flu shot, and I got it in this arm. And they gave me the pneumonia shot in this arm the same day. I've been having problems with this arm ever since. And when I called them and told them about it, which was in the month of November, I think it was December, she told me to keep taking some Tylenol or something for the pain. It's some way I move it hurts. Right in this area, like, that's what the doctor told me. She said, keep taking, she said, because there's some muscle there, and that's probably the reason why I'm having. Is it supposed to last so long?
I don't think so. I have heard of that lately, and I think my mom had a reaction to a shot that definitely lasted longer.
Same way I move my arm.
Yeah, so my thought on that, it may be that a nerve got involved, and nerves take a long time to heal, or even a muscle or a ligament. If there's some kind of inflammation in there that happened after the shot, it can take a long time to heal. But I think there's probably things you could do besides just Tylenol and ibuprofen. So you may want to, this would be something that's good for the primary doctor, just like you did, because you can ask for a referral to physical therapy maybe to help kind of work that out a little bit more and to see if you need any imaging done. But this clearly does not sound life-threatening, right? So this is like pain after a shot, hurts to move, it's more of a musculoskeletal thing. So you did the right thing calling your primary doctor. Now, if this came with like shortness of breath, chest pain, feeling dizzy, high fevers, things like that, you wouldn't want to just call your doctor. You might want to come to the ER. But we could put like primary care is a good place for like muscle pain.
And it's right in that area where I hit that shot. As a matter of fact, when I got that shot, my arm swelled up and it was very hot. More so than this one where I got the flu shot in.
Yeah, I'm hoping that I think it's going to go away. But I would check with your primary to see if there's anything else. Because if I saw you, I used to do primary care, and if I saw you, I would want to do a careful exam, see if you need any imaging studies, and see if you need some physical therapy, even like 1 or 2 sessions to work something out there.
Or she could give me something at home to do. You know,
Yeah.
I've been doing, like they said that muscle is. Why ain't you supposed to exercise it? But this, just certain ways.
Yeah, you might need a therapist. So physical therapists do more than just stretch it out and stuff, because sometimes they'll do a massage, sometimes they'll do weights, certain resistance training, and sometimes they even do needles, dry needling. So they have, and they do like ultrasound or, like they have a lot of things that we don't have at home. So that would be my step for you.
Because at first it scared me because I was like, well, I can't be having a heart attack because it'll be on this side.
It would be on the left, actually. It tends to be.
Really?
Yeah. That's where people feel the chest pain. Sometimes
But it's
going
not
to the
chest
left
pain, it's just in the
shoulder.
arm.
Yours does not sound like a heart issue. No way. Yes.
I have several,
Yeah.
and I think they belong in the ER.
Okay.
One of them is high blood sugar.
Okay.
Say over, 2 is too much, but I just say over 300 high blood sugar.
Blood sugar over 300. That's a good one. It depends how you feel with that. Because if you're just noticing your sugars are going up into the 300s, but you're kind of feeling okay, that may be something you could actually talk to your doctor about. You can call your doctor and say, can you do a same-day visit? Or do you have any advice for me today? If you're feeling okay. But that type of thing with symptoms, like you're running fevers, or you're throwing up, or you're dizzy, or you're, then yeah, you can come on into the ER.
And I feel like it's ER too because I live at home by myself.
Yes, we would not be mad at you for coming in.
Right.
I would say plus feeling bad.
Right.
Because if you just notice a number, on your glucose meter and you're feeling okay, you're doing your things, it may just be you talk to your doctor's nurse and they can adjust your medicines and you go on with your life. Then you spare yourself an ER visit. But if you're in doubt, that is definitely something we see in the ER for sure.
Okay, well how about low sugars too?
Oh yeah. Low sugars are even more. Because what can happen with a low sugar, of course, is you can like pass out. You could black out or have a seizure or something. So if your sugars are running low, you're getting sweaty, jittery, lightheaded, you probably have instructions to take some glucose right away or drink some orange juice, and then you can call 911 if you think you can't even make it.
What about severe stomach cramping and pain?
Yeah, how old are you?
61.
So yeah, severe stomach cramping, that is something that we see in the ER. Like,
Because I went just last Thursday for that. And I'm glad I called because it was hurting so bad. Like I said, I live by myself. I don't take chances living by myself. Even though I live maybe 5 minutes from the hospital, but anything can happen when you're driving and you're trying to get to the hospital. First of all, you're hurting and you're not thinking straight. So I'll call that rescue squad in a minute,
Yeah.
And
I tell people, if your gut tells you to do that, you do that. The only reason you don't want to do that is if there's like an easier way. I mean, of course, we don't want people calling the rescue squad all the time because then they get all tied up. But like I prefer for people to not call the rescue squad for, say, you know, foot pain since 1963, which I did have someone call the rescue squad for that one. That's something more for the primary doctor. But like, you know, if your gut tells you I'm sick and this could be really dangerous, it's not a mistake. Sometimes the rescue squad comes out there and they'll check you out and reassure you and say you're good, you don't need to come in.
And so about time they put me on the rescue squad from the severe cramping and hurting, I just threw up everywhere.
Oh.
And I went both ways. So just imagine me trying to get to the hospital and all of this done happened to me before I got there, you know.
Yeah.
So make a long story short, so once I got to the hospital, they did a CAT scan on my stomach and everything, and in the process of them giving me narcotics and stuff for my severe pain, I'm thinking that they may have gave me two, which they did give me two different kind of pain pills. One I know was oxycodone, and the other one was trauma something. Anyway, I'm just thinking within myself that they may have interact or something, because my blood pressure was very low when I got there. And in the process, as they was getting me hooked up to the IV and everything, I had to upchuck again. But in the process of me upchucking, I blacked out.
Oh, so
Because
that would be something, blacking out. You
They
definitely.
told me, cause I remember having the bag in my hand to upchuck in, right? And I began to
And then
upchuck,
you
but when
blacked
I
out.
woke up, there was a clean bag and they had cleaned me up, and I'm like, well, what happened? And she said that somehow I blacked out. And I'm thinking that those two medicines she may
Maybe.
have gave it to
We
me.
should talk about this. We'll talk about this a little bit afterward. You know, we could troubleshoot that a little bit to see what happened with you. That's another thing I like to keep the communication open. If you've been to the hospital.
And this was just Thursday.
Yeah, if you've been there and you had an experience, you have questions about it, you know, you call us up and they'll even get you to me, okay?
So I was afraid, okay, they finished with me everything. I began to feel better about 6 o'clock Friday morning. So they told me that, you know, I could go home, and I told them I didn't want to go home
You didn't want
because
to.
I
We'll
live
talk
by
about this.
myself.
We'll talk a little bit more
Okay.
about this. But this brings up a couple of things like blacking out. Blacking out is a big deal. If you stand up and you feel like you might black out, or you actually black out, okay, that would be a reason to come to the ER. And that would also be, if you're alone, a reason to call 911 because you'd be in no position to drive. A couple of other important ones, I think, coming for in your age group in particular, you definitely want to come. You definitely want to be seen for chest pain, breathing issues, and stroke symptoms. So these would be good reasons to also come to the ER and call 911. So if you're having chest pain, if you're having trouble breathing, you know, that's the kind of thing. Don't wait for your doctor. Don't go to urgent care. That's when we want to see you. That would be another reason that you could call 911. Now, another area that we think about are injuries. So you may fall, you may sprain something, you may cut yourself. And so generally, again, if you hurt yourself in a way that concerns you, scares you, you're bleeding, or you see a bone sticking out, or there's something that, you just come to us. We will not question you. We're always happy to see you. But if you have like a minor cut, so let's say like you're cutting vegetables, you cut yourself with a knife, you put something on there, it stops bleeding, you can go to urgent care and they're happy to take care of that. A sprain, or even possibly breaking a bone. Like let's say you fell and your wrist looks swollen and you think you might have broken a bone, they can take care of that. Now, if you, minor fractures or breaks, if you break something and you see bones sticking out, or there's bleeding, or it's like, you know, you're sick, it's a hip, you can't walk, that kind of thing is not good for urgent care. But minor injuries is good for urgent care. Like a cold, a cough or a cold, they can help you with that. Not if you're having any chest pain or shortness of breath or dizziness or anything else, but you know, the minor runny nose, sore throat kind of stuff, they can see you for stuff like that, you know. What else? What about these gentlemen? It's been kind of quiet. Have you had to go to the ER recently? No? Oh, good, good.
These folks don't even go to the doctor, period, not unless you put them in a wagon and drag them. Sir, they won't go.
They won't go, yeah. I tend to be in that camp myself. I do not like going to the doctor. But a good thing for primary care too to think about is this a problem that's kind of minor and it needs to be taken care of over time. So if it's something that's going to last a long time, that's a good thing for primary care because they can see you. Like, you know, you got a cut, it didn't heal well, and someone's going to have to watch this over time. That's a good thing for them. The other thing primary care does is prevention. So I don't know if you know what that includes, but it's things like checking your cholesterol, so preventing health problems, checking your cholesterol, doing your colonoscopy, doing your sugar check and your blood pressure. So if you're feeling good, the primary care doctor still sees you so they can keep you feeling good.
What about an elderly person, meaning 75 plus, and they, you know, may have a little dementia or whatever, and they have a fall? Which way they should go with that?
Yeah, that sounds a little bit like an ER. Because sometimes when you fall, in the older age group, if you have a significant fall and you might have a fracture, that's not something urgent care would really be able to handle. A lot of people in your, y'all look very mobile and very good here, okay? But in about 10 or 20 years, if you fall, it often means you'll have to stay in the hospital because we don't want to send people home if they're falling. You know, you can break a hip, and hip fractures come with all kinds of things. But once someone is older with dementia, then any acute thing that happens to them tends to be more of an ER visit, so we could say here, like, I don't know what I'm
Or either if they're on a blood thinner, wouldn't that be like an ER because they could have internal bleeding or something?
That's right. People who fall and hit their head particularly, if you hit your head and you're on a blood thinner, you must go to the ER.
I had a friend yesterday tell on the floor hit his head.
Yeah.
He ain't doing all that good. Stephen
Yeah.
Marvel.
Yeah, see, that's the kind of thing we would like to see that. You know, major trauma or fall. I mean, sometimes I'll have someone that, you know, you just kind of slide out of bed or you miss the chair and you hit your bottom and you feel kind of okay. You're walking around living your life. It's okay. You don't have to come into the ER. But generally, if it's a fall in an older person, it is good to get checked out.
How about acid reflux? I have a lot of that.
That's a good one.
Heartburn.
Yeah, so that's a great one because that is something that is not immediately life-threatening to you. It's a nuisance and it needs to be addressed, but it's sort of something someone's going to have to work with you over time. So I would say like acid reflux would be something for your regular doctor. However, if your doctor puts you on some medicine, you've tried it, you wake up, 1 in the morning and you're feeling horrible, come on in. We have extra stuff we can give you. So what I mean to say is, you could still come to the ER for acid reflux. People do it all the time. But to really get it improved over time, your doctor is going to have to work with you. And then, sometimes acid reflux is not acid reflux.
That's right.
So that's the other thing to know. Is this a symptom I've had for a long time and I know it well? Okay, I can call my doctor. Does it feel different to me? Like this time, does the reflux make me dizzy or short of breath or something else? that's more of an ER visit. Because sometimes heart issues can sort of feel like acid reflux.
Can you explain to me exactly what is, from that visit that Thursday? They said I had, well, it was a viral stomach infection, but they called it
Gastroenteritis?
Uh-huh.
Yes, that's just the stomach bug, stomach flu. It's when a virus gets in your intestines and gives you vomiting and diarrhea and cramping.
Uh-huh.
And it tends to be very harmless. It just kind of comes, makes you feel horrible, makes you feel like you're gonna die,
Yes,
but you
ma'am.
don't die.
Okay, how you pronounce it again?
Gastroenteritis. And gastroenteritis, you can go to an ER, you can sometimes go to urgent care for that because some urgent cares are equipped with IVs, so they can just put in an IV for you.
Gastro.
So we could even put that here, gastroenteritis. You know, doctors, we have to come up with really big words to make ourselves sound smart.
Can you make it smaller so I can pronounce it?
You say stomach flu.
You say
Say
something?
stomach flu, and if anyone gives you a hard time, send them to me. Because we're not supposed to be like, well, I feel like we're not supposed to have words that confuse our patients, but we
Yeah.
somehow do.
Okay.
Tammy, can you think of anything else? Like,
So we talked about prevention, but I think just that annual visit, I think I also heard that we have some guys that just never go to the doctor, and the importance of being followed by primary care and what advantages that can be.
yes. So that's the thing is in the ER, like I said, I'm happy to see you. I love seeing people and I love giving them lots of love and taking great care of them. But I did primary care and there's a big difference. In the ER, I can treat you for what's going on right then, but I cannot look at your whole health and keep you healthy going forward. That is not what we are equipped to do. So things, if you came to the ER as your only doctor, a lot of things are gonna slip through the cracks. There are lots of ways that your primary doctor keeps you healthy. So that's like, you know, things like checking you for cancer, checking you for high cholesterol and high blood pressure, which can prevent a stroke. And it seems kind of small. You're like, well, my blood pressure's a little higher, my sugar's a little high. But then one day if you have a stroke and you're devastated and you're paralyzed on half of your body, that's when you realize how important it would have been to get all those screenings through primary care. So I definitely think everybody needs a primary care doctor. It took me a long time to get one myself, but I finally got one. And it's nice that someone just checks on you, you know, for all those little things, like, how are you feeling day to day? Is there anything I could help with you? You know, like.
Your prevention is very, very important because when I was 23, I'd go for my annual checkup and they found out I had cancer. So if I hadn't have gone, I wouldn't be here right now talking with you. So yeah, go and get your checkup, annual checkups. My husband he goes in for his annual CT scan for his lungs. They found out he had cancer. They went in and they did a biopsy, then they did surgery on him. Within 5 weeks, he was cancer free. So yeah, going in and being checked out is very, very important.
Wow, thank you for sharing that. Yeah, cancer is a big one. Your primary care doctor can screen you for cancer. Cancer treatments have gotten so much better. So it's kind of an easy way to protect yourself, you know, and add years, add quality to your life and add quantity to your life. So I would say that's really important to just be checking in with someone. Do you really don't have a regular doctor?
When you say primary care, that's a regular doctor, right?
Yeah, that's what I mean. Sorry, yeah, primary care is like, yeah, regular doctor.
I have a question. What is, explain to me when they say my white blood cell was a little, up or off or something.
Yes, your white blood cell level can go up if you have an infection, which it sounds like you have. It can also go down with some infections. Like viral infections can make it go down. Some infections can make it go up. And that's all normal. That's what your body's immune system is supposed to do. And once you feel better, that should go back into a normal range.
Okay.
Anything else, Tammy?
I think that covers it. I think the other one that the primary care can observe is your well-being overall.
Uh-huh.
And it might be your sugar's high and you don't know it, and they're gonna observe you just in conversation. You might be slurring your speech a little bit, or you might be a little off balance, or not quite as sharp. That doesn't mean you have dementia. That just means, I'm observing something a little off today.
Yes, that brings up that is a great point, because that is someone who knows you.
Yes.
When you come see me in the ER, you may see me or one of my colleagues. Now, granted, I have a lot of people I've gotten to know in Roxborough and love, and so I do know when there's something off with them, but your primary doctor gets to know you, they know who you are, how you act, and they can tell a difference. The other thing they manage is your medicines, and this is really important, because if you start getting medicines from the ER regularly, it kind of is like too many cooks in the kitchen. So you've got me giving you some medicines, your primary giving you some medicines, your urgent care giving you some, so it's better to have your primary looking at your medicines. Because also as you get older, someone needs to check that list every single time. Because the same medicine you take when you're 60 is going to affect you differently when you're 65 or when you're 70. And so someone needs to be looking at your medicines and sometimes coming down on the dose or taking them off your list. And we're not as good at that in the ER. I do try to review that with people, but medication management is really important with primary care.
Also, don't they help you, like if you have mental
Yeah.
evaluation?
That's a great question. We actually can help, any of these places can help you with your mental health. I would say if you get into a place with your emotions that is so dark and difficult for you that you don't even know where to turn, you might feel so depressed you don't want to live, that kind of thing, that's an ER visit, okay? That is something, we want to see you for that. Because that makes it hard to even do the next step that you have to do. So if you feel like you can't function, we want to see you. But primary care could work with you if you say, hey doc, I just feel, I feel like my mood has gone down over the past.
They ask me every time I go in, they ask me about my
Yeah, they want to make sure you're happy and you're enjoying your life.
I'm gonna keep you on schedule. Anybody have any other questions for Dr. Jonnal? Well, thank you so much for being here tonight.
Welcome. You're welcome. Yeah, please spread the word to your loved ones that, we're here for you. We would love to take care of you. I hope I never see you.